the Medical AI Podcast.
Hello, I'm Dr. Felix Beecher, and this is the Medical AI Podcast, a 30-minute thrill ride of big ideas. We talk to a range of top guests, from industry innovators to scientists to philosophers. This is brought to you by Informatech, where I'm the head of healthcare technology. Worldwide, the capacity of health systems is being strangled by the complex needs of aging populations and the rise in chronic diseases more generally. Radiology departments in particular are simply unable to meet a massive and rising demand, and patients are facing ever longer delays in treatment. Now, much has been made about the ability of AI systems to interpret medical images as well or better than human radiologists. But are we really moving towards a future in which AI systems have transformed radiology to the point where they are independently processing scans quickly and accurately and, crucially, en masse? With me to discuss this, I am absolutely delighted to welcome Fabian Schoeck, Head of Global Product Management for AI Products at Siemens Healthineers. Fabian, a very, very warm welcome.
Well, thank you very much, Felix. Thank you for having me and the very kind introduction.
So, Fabian, could you just introduce yourself and explain a little bit about your work at Siemens Healthineers?
Yes, sure, Felix. So I'm sitting here in the global headquarters of Siemens Healthineers in the Erlangen area in Germany. And my team and I, we're looking at clinical decision support solutions. So taking the potential of artificial intelligence and software solutions that aim to help clinicians deal with the growing workload, as you mentioned so nicely in your introductions. So we look at different clinical fields, different imaging modalities, different body regions to provide solutions that aim at improving the accuracy of radiologists and clinicians, and to allow it to really have an affordable, scalable way of transforming radiology and providing better outcomes at affordable cost.
Okay, great. So let's talk a little bit about the problem that this kind of area is trying to address. Could you unpack that a little bit?
Yeah, so what we see is that this growing and aging population, of course, combined with also the access to imaging, which is, of course, great because it gives clinicians all this additional insights that wasn't there in the past, that this leads, of course, to a very, very high burden for the clinicians that need to deal with this. So the radiologists are facing an ever-growing workload, and at the same time, there's a shortage of well-qualified and trained staff. And the Royal College of Radiologists in the UK is publishing every other year the study on the census of the workforce, and they show very clearly that this gap is growing significantly. And by the year of 2025, they actually project a shortage of 44% of staff that is required to deal with that workload. So this is one of the challenges that we want to help to resolve and do our part in that.
Okay. Look, it might be worth mentioning as well a bit of context, which is in the UK, doctors and nurses are also on strike at the moment, partly because of workload. So it's a kind of a self-fulfilling vicious cycle, isn't it?
Yeah, definitely. And I believe there was also an examination by the Parliament to look into why imaging exams are not being read and reported in due time, right? So you really see the real world effect. And of course, the UK is not the only country. You can see that in every country. And actually in the developing part of the world, you see the opposite, right? You see the missed out potential that people would get affordable access to healthcare. So it's different phases of the coin, but you definitely see that there's a lot of opportunity with the rise of the technology and of what it's capable.
Yeah, okay, good. All right, well, let's talk about your specific work at Siemens Healthineers. Could you talk about your big project there, this idea of automating medical imaging?
Yeah, so I mean, want to do nothing less than really doing our part in transforming radiology. So together, of course, with the radiologists, make sure that the tools that are possible with artificial intelligence, that they arrive in the daily routine and that they help to increase the accuracy, make the work more efficient, help to do the right tasks of the radiologists faster, and ultimately really then also providing the economic benefits that allows more patients to get access, that allows our customers also, our the hospitals and the care networks to operate at an affordable cost position. So this is what we're aiming for.
Okay, so let's get more specific. Could you give some specific examples of your work in this field? Maybe talk about particular disease types or particular types of imaging modality?
Yeah. So of course you need to slice and dice the problem, right? And what we're doing is we look at across the modalities and diseases and body parts, and we start to look at what are the most relevant and the relevant use cases and the ones where we have the right tools at hand to make such a difference. And what we do with the AR Companion, which is our product family of AI offerings, is that we took some examples or some use cases from the oncology world, where there is a significant need for the AI solutions and also the potential to improve the workflow and the results. So we have a solution that deals with the lung on chest CT. We have a solution that looks at the lung on chest X-rays. We also have a solution that looks at the upcoming topic of prostate MR. And beyond that, we also look at the brain in some functions and also at general organ segmentation when we look at radiation therapy planning.
Okay, do you want to take one of those examples at a time and explain a little bit more detail?
Yeah, let me maybe start off with one very specific example that also might highlight the motivation why it's such a fascinating topic to work on, and that's from the field of chest X-rays. I was recently talking to Professor Borgrefe. He's from Minden in Germany and overseeing a larger hospital network there and connected to a university hospital. And he was telling me about this case, and they're using our chest X-ray solution. He was telling me about this case where an 80-year-old lady actually came back for a follow-up exam with indeterminate chest pain and a cough. And she was going to one of the satellite hospitals. And only actually by using the AI solution, they identified in the main hospital that there was an oversight by that radiologist in a satellite hospital, and that there was a lung nodule which had not been reported on. So they were able, based on the result of the AI solution, to say, oh, wait, there is something that we should look at, sort of as a safety net that was provided. And they called the lady back in and actually found that there was a lung nodule which was still in a favorable condition so that they could go into the treatment and actually turned out very positive for the woman. So this is one of very specific example, of course, but which highlights why it's really such a great thing to work on, because those solutions can really make a difference in patients' life.
Okay, so in that particular patient's case, what was she being assessed for when she went in the first place?
Well, it was indeterminate chest pain, right? So she definitely had some chest pain and also a cough. But for an 80-year-old lady, I guess that's also not something that you would be very concerned about. So they're doing a routine chest X-ray exam and trying to get to the root cause of it. And I think that's sort of what clinicians are often very much challenged with, right? I mean, what's the differential diagnosis and what are all of the things that could be going on? And in that sense, I don't think it was very specific. And that's also why the clinician probably thought, okay, it's not too bad. She'll come back if it's getting worse. And then we look at it again.
Got it. Okay. Now, I would imagine that the most common type of medical imaging procedure is breast cancer screening, because women typically go for that once a year from a certain age and for many, many years. So that breast cancer screening is generating a vast amount of data. Could you talk about that as well?
Yeah, and the good thing that you bring it up, because that's actually also what brought me to AI in the first place, because in my prior role, I was responsible for the women's health segment. So also looking at, okay, what options do we have to leverage AI in mammography screening? And there we are actually working with a partner from ScreenPoint Medical, a very great startup from the Netherlands. And they're developing a solution that does exactly what you're pointing at, that there's such a huge workload of mammography screening exams that are of 1,000 exams, 970 around are coming back without any actionable finding and any relevance, right? So this is really workload that in most countries in Europe is double read by 2 human radiologists and creating an immense workload for no effect. So in that sense, it's really a great opportunity for AI to assess this workload, to look at those images in an automated fashion, and then to give also a recommendation which studies, which images are actually worth the time of 2 human radiologists, or maybe also making sure that there's a potential to bring it down to 1 human plus AI, like some of the studies have shown that this is really a very promising approach.
Yeah. Now, breast cancer is especially interesting in all sorts of ways. First of all, I should say I'm not a radiologist, but I'm guessing that there are images of mammography images where a cancer is very obvious. And then there are cancers which are very much in a grey zone. And if you are a radiologist with a vast workload, and like you said, almost 99% of scans are fine, and you've got to pick out those grey cases, I can imagine that the error rate can be quite significant, especially if you're tired and overworked and all the rest of it.
Yeah, exactly. And I mean, that's one of the huge benefits of AI, right? I mean, it never gets tired. It's consistent. It's on the standard performance, right? So, of course, validating AI system is a difficult task, but what you can establish with AI is really understanding what is the level of performance that you can expect, and making sure that you get the same performance whether you're looking at something at 6 or 7 in the evening, or if it's with fresh eyes in the morning.
Now, I think from the point of view of men's health, just for balance, the most common form of cancer in men is prostate cancer.
Yeah, exactly. So
do you have something geared towards prostate cancer as well?
Yeah, we do, and you're perfectly right. So the statistics say that 1 in 8 women gets affected with breast cancer, at least in the United States, in her lifetime. And the same is actually true for men. So 1 in 8 men will experience prostate cancer in their lifetime. And as men are getting older, especially beyond 50, this is very relevant for us men. And that's why there's also big efforts to look into targeted screening programs to how can scans or screening for prostate cancer be effective. And because this involves, mammography, right? X-ray is comparably cheap, but MRI imaging is actually quite complex still, and also much more cumbersome and expensive than X-ray imaging. So this involves then also the question, how can screening be effective from the clinical benefit, but also from the economic benefit? And especially in the Nordics, you see a lot of studies now and activity going on, because they are really also the trailblazers in screening programs, how this can become cost effective, and automating part of that workload through AI solutions is definitely a big piece of the puzzle there.
Now, one question I'm sure that people will have is, what is the state of evidence currently? I mean, you've talked about replacing 2 radiologists for screening with 1 radiologist plus an AI. What is the current level of evidence for that, for example, in breast or prostate cancer?
Yeah, definitely it's a field that is sort of in the beginning, and it needs more and more evidence. But what we're seeing is very good and promising results from studies. So I mentioned the Nordics, and we have also studies there that show that, for example, when it comes to assessing the volume of the prostate gland, that actually our solution is up to the gold standard that is being used there. And when it comes also to assessing lesions and identifying relevant prostate lesions, that in an aided scenario, so the human radiologist and an AI solution is outperforming the radiologist who does not have access to such a solution. Of course, the setup of those studies is complex, and there's a high dependency, of course, always also on the prevalence of the finding you're looking at in the population and how the specific workflow looks at. So I can only encourage everybody to really get involved in such activities, right? So this goes out to the clinicians, but also to the industry to really work on laying out these studies to make sure that the benefits are clear, that it's also clear upfront what can be expected, but also where the limitations are of the current solutions.
Okay, now where would you say we are with the level of implementation? Maybe in Germany, maybe in the States, maybe elsewhere?
I would still see it as an early stage, right? So when we think about the adoption, then we see that, I think, and the recent surveys also by ESR and others have shown that I think all of the radiologists that are giving it a thought of what role AI will play. Many are in the steps of having first use cases already in a phase where they are either using it really in routine or at least trying it out and getting informed about it. But it's not widespread and not about all clinical indications, etc. Right? So I would still see it as in a starting phase, but I would also see that there's little doubt that this will be transforming healthcare as we know it.
Okay, now we are both men of science and we like statistics. So is it possible to put numbers on the degree to which these kind of the introduction of these kind of systems could improve patient outcomes?
Yeah, I mean,
we don't shy away from difficult questions on this podcast, Fabian.
Sorry that this then leads to like a politician answers, because I mean it depends, right? Because it really, of course, makes a huge difference whether you're talking about something like breast cancer screening or prostate cancer in a screening setting where it's very much reproducible, right? So if you look at the population coming back for mammography screening, then you have a very well understood population compared to other use cases. So it really depends highly on the use case and also what benefit the AI solution has, right? So we're talking about oncology use cases, about screening use cases. Those are completely different animals than you would have in acute settings, for example, when it comes to flagging out signs of strokes, early onset of stroke, right? So I think AI is too generic to have one number that says that this is the benefit of AI. I think it's rather the underlying fundamental technology that will play a part in every clinical workflow. And then you really need to look at the specific clinical workflow to flag out the benefit. But it is possible to do that, yes.
Mm-hmm. Now, do you talk to governments or people in governments? I'm guessing you might.
Yes, yeah. So, I mean...
And I guess you get asked this kind of question, right? So can you quantify the cost savings? Can you quantify the improvement in patient outcomes? How do you handle those kind of questions when you talk to governments?
Well, also there, I think it's then... Of course, there are general discussions about how to regulate this, how to foster adoption, etc. But then when it comes to implementing it, it always gets very specific about specific clinical use cases, and that's also what makes sense, right? And because you brought up the governments, right? I mean, it's also a complex landscape. You have like the individual clinicians that are looking for help in their daily workload. Then you have the hospital level, C-level, the care network level that looks at how can I optimize and improve my operations. You have insurance companies, payers that think about, okay, how do we actually improve the cost position? How do we make it also affordable for, on a socio-economic level, to have a screening program for prostate cancer, for example? And of course, governments also saying, okay, how do we bring such an exciting technology into a real game changer also in the real world?
Okay, good. Now, I think this notion of mass screening programs being, I don't want to say taken over, but being supported at least, perhaps even led by AI systems, is just so fascinating because it's the kind of thing that people who work in AI want to see. But I'm sure, as you say, it's an extremely complex business. Could you talk about the kind of challenges that you have faced in trying to get these kind of systems implemented?
Yeah, sure. I mean, definitely the change management, right? I mean, it's really about changing how clinicians work, and obviously, like all of us also in private life, change is always something that needs to be managed so that adoption happens, right? And you will have early adopters that embrace the change and the potential, and you will have the other side of the bell curve, right, where the people are that really oppose every change. And just like you would see when you look at how long did it take to have digital imaging actually play a role in radiology, you should expect the same for AI, right? That yes, you will have a rapid adoption for many customers or many clinicians, but at the end of the day, this will be also a curve where there will be laggards and people that will stick to the old routine for quite some time.
So let's think about what radiology might look like in, let's say, 5 or 10 years in the future. How do you think the role of the human radiologist will have changed?
Yeah, so I mean, there's this very, very famous saying, a quote by Professor Geoffrey Hinton, right, who said in 2016 that people should stop training radiologists right now because it's completely obvious that in 5 years, deep learning is better than the radiologists. I think he realized himself, and I just saw an interview with him some days ago, that he was a bit too optimistic when it comes to the timing of that. But definitely we will see that AI is a relevant technology for fundamentally changing radiology. And I think a second quote by Professor Langlotz from Stanford puts it quite nicely that this replacing humans by AI is the wrong kind of question, because it's obvious that the radiologists will be there and they're in the driver's seat to actually make the most out of the AI technology. So I would say 5 years, 10 years from now, you will see that in the leading hospitals, AI will really delivering on its potential, but at the same time, you will also see that there will be hospitals where radiologists are stuck in their previous routine and doing their job like today.
Well, in fairness to Geoffrey Hinton, I mean, I think by 2021, there was a ton of studies showing exactly what he said, right? Which is that AI systems can outperform human radiologists in a dizzying range of disease types. So I think he was right. I mean, I guess he didn't say that all radiologists will have been replaced by 2021, but he was correct in saying that they will be outperformed in many areas.
Yeah, definitely, yeah.
I had a very interesting conversation at ECR and with somebody who develops AI systems for radiology. And he said, well, look, it's like this. It's a bit like if you go in an airliner, you know that the pilot is going to be busy in taking off, he's going to be busy in landing, and the rest of the time, he's just going to have his feet up on the cockpit, reading a paper, sipping a beer, doing nothing. Right? And he said, well, it's a bit like that with radiology. We still want the pilot there, so the pilot will always be there. And it's the same with radiology. And I said to him, yeah, but okay, well, what if the AI systems become better at taking off the plane and landing the plane? What do you do then? I mean, why would you still have pilots in that case? And he didn't really have an answer to that. And I kind of wonder whether it's the same kind of thing with radiologists. If radiologists perform with less accuracy with the tricky cases, I'm not quite sure what the justification would still be to have the human radiologist in charge. Can you respond to that?
Yeah, I think that's actually a very nice analogy. But I think actually it's a little bit different for radiologists if they see themselves also more than just being the ones that are finding the nodule on the image, but rather also about the connecting element of imaging to the patient. And I think that will give them actually much more importance when it comes to really making sure that the imaging that is being done is the appropriate one, that it's really also delivering the actionable insights for the referring physician. So I think the role of the radiology will change, and I think they know that. So there was this paper also about radiology in 2040, which was published in the end of December, which highlighted that. So I think the radiologist community is aware of that, but it's going to be a change rather than really getting rid of a pilot. And actually even the plane, right? I mean, you will have some representative of the airline on the plane that will manage also how the flight is conducted, right? So I mean, for the true blood pilot that wants to really fly a plane, the job is going to be a very, very different one. But there will be definitely then persons in charge that need to manage it.
Yeah.
And I would see that also for the radiologists, that they will be the persons in charge to manage everything around the imaging.
Yeah. But I'm not an extremist. I mean, the doctors I know, which is quite a few, are all excellent people. And I mean, if I were going for a scan, I think I would probably want a human radiologist looking over the AI system too, right? And I guess these kind of perceptions are quite important, right?
Interesting that you say that, because, I mean, at least if I'm a patient, I definitely want AI to look at my case as well, right? So if I'm going in for,
correct.
I mean, luckily I'm not in a lung cancer screening situation or a prostate screening situation, but if I'm having my images examined, I want a very good radiologist to look at, but I also want a state-of-the-art AI system looking at it. And I think that many patients are already thinking in such directions, and as we see now also with the hype around GPT and other AI solutions, I think that also the public opinion will really play a fundamental role in driving the adoption of AI.
Yeah. Now, you mentioned GPT. I think that the conversation has really shifted since Elon Musk objected to OpenAI and GPT. Now, by the way, when Elon Musk was talking about the dangers of GPT, as far as I can tell, he's really talking about political bias, right? But nonetheless, it raises an interesting question. Could there be unintended consequences that we don't really want with introducing mass screenings, which are AI-led?
Of course, we always need to look at the full picture of what are we changing there, right? So that's why I mentioned also this change management means also that you understand the implications of that change. And I think important is that we really have the studies in place that look at the clinical outcome, right? So not only about individual detection tasks like we have seen a lot, of course, in the past to say, okay, AI is good at detecting this or that, but really also looking at how does it change then the clinical outcome, and how does it improve the situation on looking at it from an holistic perspective.
Okay. Do you think there are any ethical issues with the idea of AI becoming more and more involved in radiology?
I would say it also depends on the level on what you look at, right? I mean, if you look at improving the quality of healthcare at the level of an imaging department, then I would say by having studies that look at the bias and make sure that really the performance of AI solution and the imaging assessment is good at the end, right? I think I would not be too concerned. If we think about now the bigger picture of how AI systems could then be used also to certain put people into categories, etc., right? Give also insurance companies, governments, payers also the chance to make assessments that are unfavorable for some parts. I think that's definitely something where it also needs the political focus to put also guardrails into place of what is allowed and what's not allowed.
No, I think that's exactly right. I think bias is definitely an issue. But I guess with any major innovation, people are going to worry, right? And I guess that's kind of what's behind the kind of, would you call it a moral panic? I don't know. There's a bit of a moral panic going on about AI right now. Yeah. Okay, look, Fabian, you have given fantastic answers. It's such an interesting area. We could talk all day long. But I want to ask you the last question, which is, what is your favorite current example of medical AI, nothing to do with your own?
Yeah, so I really like the topic of digital twins, but I feel that's too close to what we are actually doing at Siemens Healthineers.
Okay.
So I would go really outside of radiology. I like the topic of AI-powered drug discovery. So
Yeah.
that really also is one of those areas that shows the huge potential of scalability and automation, because instead of, tedious manual development and simulation works, you go into a very autonomous way of going in different directions to identify the best drugs that will deliver the impact, and even simulations that then show the effects of such drugs. I think you had somebody on your podcast a while ago on this topic as well, right? So I think that's really such a groundbreaking topic as well, and really exciting.
Absolutely right. Okay, good. Fabian, you have given beautiful answers. I'm so grateful to you. I've really enjoyed the conversation. Thank you so much, and the best of luck with your program of research.
Well, thank you, Felix. It was really a pleasure to talk to you, and keep up the exciting work, and looking forward to hearing more.
Great. Thank you very much, Fabian. Bye-bye. Thank you for listening. I'm Felix Beecher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.